Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Gary Johnson, Regional Sales Manager of NICHOLS, S.A. NICHOLS Brokerage, home of MyMedicareQuestion.com. And so we welcome you to the show, Gary.
Thank you, Anita. It's great to be here.
Right. And, of course, he stayed at Seminole Hard Rock last night where we had our big expo yesterday, which was, I'm so exhausted. I'm still recuperating from it myself and everybody. It was, the crowds were just steady, and we appreciate everyone, if you're listening, that you were one of the lucky ones who went there. I hope you won some things. But I know that MyMedicareQuestion.com was a big sponsor of ours, and we were so happy to have him there because everybody has questions about Medicare. I think the name of your company is great. It's MyMedicareQuestion.com, right? Everyone has questions.
Absolutely. Who doesn't come across a question, whether you're helping your parents try to navigate when they're turning 65 and going on Medicare, or you're retiring, you're coming off of your group plan, and, what do you do now? Some people are drawing their Social Security check, and they're going to get their Medicare card mailed to them automatically. Others aren't. And so we get that question quite a bit. What do I do next? So by going to MyMedicareQuestion.com, it's a great way to get those questions answered.
So now, does someone actually speak with a representative, or how does that work?
Well, the great thing about the website, Anita, is it puts that Medicare beneficiary in charge. When they go to MyMedicareQuestion.com, there are no forms to fill out. The whole idea behind this is to connect the people who have the questions with those who have the answers. Those local independent insurance agents who get certified every year to be able to discuss the Medicare plan. So the idea is to provide them with local contacts. We put on the website the agent's picture, the agent's phone number, and the agent's email address. So now it's up to that Medicare beneficiary who has those questions to reach out to that agent that they pick and choose. And they can call or they can email that agent. It's up to them.
And you have something that you give out, I believe. It's called My Medicare Question. I'm sorry. Let's see. Yeah, it's it's Medicare Made Clear, right?
Yes. United Healthcare creates a wonderful educational document called Medicare Made Clear. And so we handed that out yesterday at the expo to a lot of people who just, are 62, 63 years old, coming into Medicare in a few years. And it's a great piece that gives them a nice foundation of what to expect, what Part A covers, what Part B covers, Part D, the prescription drug benefit, the dreaded donut hole. So it really does a nice job of explaining the basics. It is not pushing one plan over another. It's just providing information. It's a great educational piece.
I bet you ran out.
We did. Absolutely.
Everyone ran out. In fact, we had so many wonderful people, and they just ran out of everything. So it's nothing we could do about that. But so you just talked to everyone. Well, tell me what you feel is the biggest question that people do have. Number one, there must be one that just everyone is asking.
Well, there's usually two questions we hear most, and that is, what is the difference between a Medicare supplement and a Medicare Advantage plan? And so it's important to understand the differences between the two because they are vastly different. And so a lot of what a local insurance agent will do is start there and just explain the basics. What your options are when you go on Medicare. And when we say go on Medicare, really we're referring to your Part A, which is your hospital insurance, and your Part B, your medical insurance. So you can go down one of two paths. You can stay on original Medicare, and you can take out a Medicare supplement, which will typically cover the cost that Medicare doesn't, pick up the deductibles, pay the 20%. Then you also have to add a separate plan for your prescription drug coverage. And so this is one option. And for some people, it's a great option and a great fit. People who don't want to worry about a network of doctors and hospitals. They don't want an HMO plan. They want to go to any hospital, any doctor that accepts Medicare. A lot of people who travel, they may go back home up in the north in the summertime. They come down here in the wintertime. It's a great option. Other people may want a Medicare Advantage plan. And those plans typically have lower premiums. They'll have co-pays typically. They usually include prescription drug coverage, but these are usually network-based plans. So it's important to make sure your doctors are in the network, your prescriptions are in the formulary. So we really try to stress the importance of understanding your options first. And that's what an independent insurance agent will do. And then the second question we hear a lot is, when can I make changes? And so that's usually the annual enrollment period, which is coming up here in a few months. So October 15th to December 7th is that time of year, the annual enrollment period, where people can make changes in their health care coverage.
All right, and so the very things that you just discussed is that is two of the important things, I think. So what about people who have now gotten on Medicare yet, but they're thinking of, they're going to be 65, and that's the age, the magic number, right?
For most people, absolutely.
Now, should they be signing up ahead of time? Because they can't get benefits till they're 65, right?
That's correct. And the question that we typically ask is, are you drawing your Social Security check yet? Because if let's say you're retired and you started drawing your Social Security check, you're going to get your Medicare card mailed to you about 3 to 4 months before your Medicare benefits begin. So if you're turning 65 during the month of June, your Part A and your Part B will start June 1st, and you'll get mailed your card about 3 to 4 months before that time. And then you have a 3-month window before June 1st if you wish to get signed up for a plan and have that coverage start June 1st when your Medicare starts.
Okay, so go ahead. That's very important.
Yeah, but let's say you're still working and you have your group benefits from your employer. If you're not drawing your Social Security check, then you will not get your Medicare card mailed to you automatically. So at the time that you decide to retire and you come off your group plan, you'll then need to contact Social Security about getting your Medicare benefits started at that time. And so you'll get to decide if you wish to start drawing your Social Security check. You can do that. You can pay your Part B premium out of your Social Security check at that time. Or if you wish to take out your Part B, but you still don't want to draw your Social Security yet, that's okay. You'll get billed quarterly for your Part B premium.
That was going to be my question. You just answered it. If someone didn't want to take their Social Security, but they definitely want Medicare, they can do that.
Absolutely. Absolutely.
So one has nothing to do with the other. Well, what are some of the complaints that I'm sure people said, oh, boy, I've got so many things I have to complain about. What? And because they never usually get a live person like you are to complain about. So what were they? I didn't hear anybody screaming over at your booth, actually.
No, it was pretty calm, actually. We had a lot of people come by. Sometimes people, they don't understand because nobody has really taken the time to sit down with them. There are a lot of companies out there. Let's face it. And if you had a representative from each company come out, you might have 6 or 7 people come out. Because if you call the insurance company, you want to talk to somebody from that health plan, they're typically going to send out their representative or their captive agent who can only talk to you about their plan. So if you want to get information from all 6 or 7 plans that are in your area, you're talking about sitting down with 6 or 7 people. So what we decided to do is try to connect these folks to local independent insurance brokers who get certified with several companies, with multiple health plans, so that when they are sitting down with somebody, they can discuss multiple plans because they get certified every year by these health plans to be able to talk about and sell their health insurance plans. So that's really the key, is making sure that you're sitting down with someone and each year reviewing your coverage, finding out what's changing from year to year on your plan. And is there another plan out there that has maybe better benefits, lower co-pays, or lower premium, so that if there is something out there that meets your needs better, you've got the opportunity to switch during the annual enrollment period.
Isn't the most important aspect of this for people? Of course, money, but then the doctor, they want to make sure their doctor's on the plan?
Absolutely. So if you're looking at a Medicare Advantage plan, there are typically two kinds, an HMO or a PPO. Now, an HMO it's a health maintenance organization. It's going to have a limited network of doctors and hospitals. And so that's one of the most important things, to make sure that your doctor is in that network.
Right. And so that's, And I know that doctors, of course, sometimes they change from, I don't know the reasons, maybe they haven't liked the company or something, and then they don't tell their patients. And then when the patient goes, they don't have their doctor because he isn't covered. So it's really very important, isn't it, to make sure your doctor is covered?
Absolutely. And working with a local independent agent, that's somebody that can also help navigate those things. Making sure your doctor's in the network. If the doctor has changed, is no longer in that plan, then you can absolutely call your independent agent. You can look to see, is my doctor in another plan? Do I have an opportunity to get out of my current plan? Because with Medicare, when you change plans, you have to have a valid enrollment period. So at the end of the year, we're in the annual enrollment period. Well, some people may qualify for a special enrollment period that can allow them to change their plan during the year.
Why is that?
Well, Medicare gives them opportunities to do that if they qualify. So a special enrollment period would be, for instance, if someone moved. If they move to another county, another state where the plan they have isn't available, Medicare would allow them to switch during the year.
Right.
If someone has limited income, they may qualify for a special enrollment period to be able to change plans if they qualify for what is called a low-income subsidy, or LIS. This is also referred to as Part D extra help. So talk to a local insurance agent, ask them these questions. If something like that occurs and you feel like it would be best for you to change plans, a local independent agent can help you determine whether or not you can change now, or you'll have to wait until the end of the year during the open enrollment period.
Now I know why your booth was so busy, because you have a lot of answers.
Well, that's what we try to do, mymedicarequestion.com.
Right.
You can come to our website. You can check out our frequently asked questions. There are these questions as well as many more. And when you click on those questions, you'll actually get a video answer that will come up from an independent local broker. So, we try to address these questions, the common questions that people have. Whether you're 65 and you're going on Medicare for the first time, or you're 75 and you've been through this, but you still have questions and you still want to know where to go to get those answered. So that's what we've tried to do here, is give people a place to go. It's very simple, very easy to navigate. Again, there's no forms you fill out. You're in charge.
Those are good words. Those are fighting words. You're in charge. We don't always hear that. But I'm glad you said that. So my guest is very interesting. Gary Johnson, who's the regional sales manager for the S.A. NICHOLS brokerage home of mymedicarequestion.com. Where's your home office?
In Cincinnati, Ohio.
And so are you able to do this all over the country? You work with agents? Go ahead.
We do. We work with agents in really 49 out of 50 states. We have mymedicarequestion.com. It's really an advertising platform for the agents that we're working with. And we started this in Ohio, it's our home state, and we have grown to about 6 states now where we're advertising, we're promoting local agents. A lot of these are small business owners who really can't afford some of the advertising on their own. So we want to be able to provide that to them and help connect them, the folks who have the answers, who every year are getting certified with these health plans, be able to connect them to those Medicare beneficiaries in their communities who are looking for, people to connect with, to help guide them, to help answer their questions.
That's excellent. I'm so happy about this. Now, what will happen then? So October, you said October, is it November or October, then they can make their change?
So October 15th through December 7th.
All right,
That's
but
the
they shouldn't
annual
wait.
enrollment.
Shouldn't they know what they want to do by then?
Well, the 2016 plans, for instance, the changes from 2015 to 2016
Uh-huh.
in those Part D plans and those Medicare Advantage plans, that cannot be discussed until October 1st.
Oh, I see.
So Medicare and the government agency that administers Medicare, it's CMS, stands for the Centers for Medicare and Medicaid Services. They set the rules that everybody has to play by. And they said that October 1st is the beginning of the 2016 marketing period. So folks have about a 2-week window from October 1st to October 14th where they can go out, they can hear about the changes in all of these Medicare health plans, Advantage plans and Part D drug plans, without really having any pressure to get signed up to change anything. So you've got from October 1st to October 14th where you can just go out and get information. Beginning October 15th, that's when, if you wish to make a change, you can do so. Now, people who are happy with their plan and the changes that are occurring with that plan from 2015 to 2016, they don't have to change. They don't have to re-enroll. If they're happy with their coverage, they can simply stay on what they have, and it'll carry through into next year. But if they do decide they want to make a change, they'll have between October 15th and December 7th to sign up with a different plan, and that change will take effect on January 1st.
I see. That's very, very clear. Thank you so much. So Gary Johnson, Regional Sales Manager of S.A. NICHOLS Brokerage, home of MyMedicareQuestion.com, is our guest today. I'm Anita Finley. You're listening to the Boomer Time Show, and we did our expo yesterday, and so I hope you were there. We had a lot of fun, and we're planning another one in January. We don't have the date yet, but just stay tuned, and we'll figure that one out. So what do you do then once people sign up? Let's see, now you said it's just through the end of the year. What do you do when you're not doing that?
Well, we've all seen and heard the statistics, all the people that are turning 65 throughout the year. And then we also know that there are thousands of people who are continuing to work past the age of 65. And so at 66, 67, 68, they decide, okay, now I'm ready to retire. Now what do I do? And so you have people who have questions about Medicare and Medicare coverage and when do I get signed up and when do I make changes throughout the year. So while it's busiest at the end of the year, there are thousands of people who need assistance, who need guidance, in July, in August, in September, because they are turning 65 or they are retiring and coming off that group plan. So that's why we want to provide the resources to these folks year-round. This isn't just during October to December. We want to be here for people in June, July, August, September, 12 months a year, because they have questions, 12 months a year.
Yes, they do. I'll tell you a little story. I remember, must have been, my father passed away in 2002, something like that. And he was, at that time, they didn't have the restrictions on the dates of when you can enroll and you can't. So every month it seemed like he was in another HMO.
Yep, I
they kept
remember
calling.
those days.
Did you? Everyone called him, and my father wasn't too sure of what he was doing at that point. And so next thing I know, he's in another one. And maybe that's one of the reasons they did this.
You're exactly right. I've been in the Medicare space since 1997, and back then, absolutely, even through up till about 2005, people could change plans from month to month to month. It wasn't until Part D came out in 2006 that Medicare decided really to go to these enrollment periods. Very similar to if you're working and you have group insurance, you can typically make a change at the end of the year. And so that's what Medicare went to, is a model where it limited the times that people could make changes to their health insurance plans and their drug plans.
Yep. So that wasn't so good, because I think a lot of salespeople just made commission, and these people didn't know where they were or what they were doing.
Exactly. And so now you've got somebody who has 3 or 4 drug cards, right, or 3 or 4 insurance cards, and I remember sitting down with people, and it's like they had no idea which one was the right one. and we would make phone call after phone call, Anita, to try to figure out, which one was active. And, it's another reason, to have somebody who is local, who can assist you. And, we really do stress the importance of that local insurance agent to help guide and help navigate the maze that can be Medicare sometimes, so that every year you're sitting down with your local agent, you're reviewing the changes to your plan, and they can help you decide whether or not this is going to be the right plan for you, for the upcoming year. Explain when you can make changes if you have something significant that occurs. It's real important to have somebody that you can turn to get those questions answered. And that's one of the reasons we created MyMedicareQuestion.com, is to be able to provide those resources to people.
If I'm not mistaken, with Medicare and the insurance, it's not based on if you've had that illness, that a lot of times you can't, insurance companies say, well, if you've already had that, then you can't come into our plan or we won't cover it. That's different with Medicare, isn't it?
Yeah, really the only medical condition or question, it stems from end-stage renal disease. So typically for a Medicare Advantage plan to be eligible, they'll ask you, do you have Part A and Part B of Medicare? Do you live in one of the counties where the plan is offered? And are you currently diagnosed with end-stage renal disease, or stage 4 kidney failure? So that's the only medical question. Now, there are some other Medicare Advantage plans that provide what they call special needs plans for people with chronic illnesses. So these are specially designed plans if you have one of these conditions, a chronic illness such as diabetes. You may be eligible for a special enrollment period to enroll in one of these types of plans.
I see. So that's why you really do need an expert. And as a matter of fact, on any kind of insurance policy, whether it's automobile or medical or even on your house, you just need to have someone go through it. It's very confusing, and I know I don't think they do it intentionally. It's just they have to cross their T's, dot their I's, and it's much better for someone like you. You've studied it. Obviously, you've been in this business a long, long time, and you just understand it. So all the little shortcuts you can just help someone with. So let me tell someone, if you would just write this down. Remember, this is Pencil Talk Radio. Write down MyMedicareQuestion.com. That's the website. Get on the website. They're going to ask you some questions. And then by answering them, they'll know where you're located. They'll help you. And I'm sure there's a live person they'll be able to talk to at that point, isn't there?
Absolutely. And just one thing I want to reiterate is that they don't have to fill out any forms. We're not asking them for any of their information. They can simply contact a local agent of their choosing. They'll see when they go on the website, they will see pictures of these local agents. They can click on that agent's picture, see their profile page. A lot of the agents have listed their hobbies and interests. They'll see the agent's phone number, their email address, the counties that they typically will service. So it's up to the Medicare beneficiary, that individual, then to reach out to a local agent of their choosing. And if somebody doesn't have internet access, we welcome them to give us a call at 844-4ME-ABCD. That's 844-463-2223.
Well, that makes it very, very easy, too, then. Thank you so much, Gary. That's, people really, there's still a lot of people, older adults, who are really intimidated by the websites. They don't know what to do, and I'm glad that you do have that telephone. So someone will help you. They'll answer the phone. They'll get you to the closest person, and then I'm sure they'll come and visit you at your home if you prefer, or you can go to their office. It's a very, very big company, and they're doing something that's extremely valuable. It's MyMedicareQuestion.com, and all you have to do is talk to them, and they, as they said, they're local. These people, even though they have offices all over the country, they have their agents local, and that you can just sit down, have a cup of coffee, and just talk to them. Because I know that if you're just getting on Medicare, it's very confusing. But even if you've been on Medicare, this whole prescription drug mean, I get that. I get that in the mail, and it is still complicated. So if this happens to you, you can call your agent and say, look, this just happened. Explain it to me, right?
Absolutely. And the other thing, too, we sometimes forget is that, as even somebody who's been on Medicare for 10 years, as they get older, sometimes it can be confusing. And now you've got a son or a daughter who's there to assist their mom or dad. And, the son or daughter, they could be in their 30s, they could be in their 40s. They have never dealt with Medicare. They've never gotten involved with their parents' health care plan. And so now we're seeing a lot of people. We saw them yesterday at the Boomer Expo. They're stopping by with their mom and dad, and they're trying to learn all of this. And again, they're 20 years from being on Medicare themselves, but now they're assisting their parents, and they need someone to turn to as well. So local insurance agents will sit down at the kitchen table. They'll review this. They'll come in the evening. They'll come on a Saturday when that son or daughter is available when they're after work. So it's all about being able to be that resource and trying to provide that information to the son or the daughter who's learning for the first time as well to help their mom and dad.
That's a good point. And I did see a lot of people did bring their adult children, and that's happening more and more. And of course, as you said, the adult children, they soon will be in the same path, but they'll be smarter because they would have helped their parents, and they'll understand. Of course, unless they change the laws again.
Right.
But for all intents and purposes, it's the way that you get to have insurance. And listen, this is a wonderful thing for older adults. Then you don't have to worry about, you get your doctor, you get the right insurance, and then just eat right and don't get sick. So
there you go.
That's what we really want you to do. So MyMedicareQuestion.com is a company that you can feel comfortable because they're not signing anything. They're just referring people to you. They know all the local people. And I gather that's the whole point, that when they call you, you'll be able to refer them to the people who you have faith and trust in.
Absolutely. And these local agents, they don't charge anything to come out and sit down with a Medicare beneficiary or their family to review their coverage. And they'll be the first one to tell them if the plan that you're on is the right plan for you, if it meets your needs, then by all means keep that plan. You don't have to change. They're going to get paid if the person enrolls. But these are people who they live in the community. They're part of the community. They're small business owners, many of them. Their job is to be able to help these Medicare beneficiaries, with their Medicare plans and be able to sleep well at night.
Well, Gary, I really thank you so much. We've just run out of time, and it was wonderful talking with you. I hope that we continue to work together.
Well, Anita, thank you so much for having us.
Thank you.
Appreciate it. Have a good day.
All right. You too. Bye.